Okay, so for the video, I'm going to restate what you said, and you can correct me if I don't do it right. After surgery, you woke up, terrible shoulder pain. Terrible
like
shoulder
shooting
pain. Shooting nerve, awful. And I see a...
Yeah, but it's not that horrible. I mean, it is a bad shooting pain, but it's weird that it's in your shoulder.
Well, it can be zero, it can be not that horrible, or it can be real horrible, it can be terrible.
Mine would go away as soon as I moved, but then it comes back.
I couldn't move.
No?
Yeah.
Right, so there's variations. Here's the interesting thing is, people have this shoulder pain, they say, oh my goodness. So I had a story I want to tell you. A very nice older lady saw me on the morning after surgery, and she said, Dr. Rutledge, you're wonderful. Thank you for taking care of me. I believe you broke my shoulder. Super polite, super nice lady. You know, you're just going...
activation, 4100 window. Marked activation, 4100 window.
So I said, you know...
Activation, 4100.
So I said, I kind of chuckled. I said, no, I didn't break your shoulder. And she said, look, you know, you don't have to be upset. I'm not upset. I still think you're a wonderful doctor. I know these things can happen. Maybe you drop me, you know, when you move me. And I just laughed. I said, I did not break your shoulder. She said, look, I'm not going to sue you. I'm not upset. She said, I can tell you, though, I had a broken shoulder earlier this year, fixed by an orthopedic surgeon. This is a broken shoulder. So I said, okay, we'll check into it. And we had the orthopedic surgeon see her, and she did not have a broken shoulder. What she did have is the pain that you have, and that's called referred pain. And as we talked about before, and as we're doing in the video, and for those of you having surgery this week, when God created heaven and earth and made your nerves, He put a lot of nerves in your fingertips. So you can tell a lot about things that you touch with your fingers. You can tell warm and cold, and you can tell wet and dry and sharp and dull because of all the nerves that are in your fingertips. In the shoulder and the chest and the abdomen, not so much. You can't really tell much of anything, and the same nerve that's used for your shoulder is also used for your diaphragm, the abdomen, and the chest and your heart. So if you ever heard of somebody having a heart attack, they can say they have shoulder pain. It's referred pain. So the pain that you felt was more severe because you had more blood, and then you also told part of the story, which is that when he got up and walked around, the pain went away. Because when he lays down, a little bit of that bloody fluid ran up along the diaphragm and referred up into the shoulder and hurts. And when he got up and moved around, that let the blood move away from that nerve and help the pain get better. So this is a hint, it's a trick, it's a tip to those of you having surgery this week. Get up and walk, and you should feel better. Now, on the other hand, I take full blame for the pain that you had, and I feel terrible about it. I feel terrible about any pain at all. And again, those of you with pain were supposed to come to clinic on Monday. But we do see some pain afterwards, and the nice thing is, in general, people get better pretty quickly after that. And so the rest of your week, I hope, wasn't too bad.
It was just the first night. As I said, once I got up, walked around 2 laps, it was gone. And I was able to fall asleep when I woke up. It was there. Walked 2 laps and it was gone.
Right. And then the other thing that we've talked about that I'd like to mention is, let's suppose your pain got worse. Okay? That's the sign or symptom that there could be a serious problem. So after surgery this week, those of you who are having surgery, if you get better from the pain, that's okay. If the pain progresses and gets worse, that's not okay, and so therefore that means we have to urgently re-explore and look for a problem like a leak or more bleeding or a problem like that. And so we did not see that in you. We saw that improvement, and so we feel terrible that you had any pain at all, but in general, most of our patients say over and over again, it's not too bad. Questions that we should talk about?
One question. Is there anything with impotence with this surgery because things aren't working like they're supposed to?
That's a really good question. Change the video on that.